where do we start? And I think it's difficult because the organisation delivers a lot of things across the course of a year, and I'm always very conscious when you stand and do things like this that you can't pick everything up. So I'm really sorry if any of you came today to hear something very specific about something we're doing and it gets missed out of this bit. It doesn't mean that that isn't something we're proud of doing, and it doesn't mean that it hasn't made a difference. It just means that it is impossible to pick everything up in 15 minutes. And what I wanted to try and do was pick up some of the themes from what Alan had talked about, but also to talk about some of the stuff that we touched on last year to show where we've made progress and to show where we've made a difference, but also to say that in some places there's always still more to do. So, it's a continuous, I was going to say battle, but it's a continuous cycle of trying to do the right things, spend our money in the right way and get better outcomes. So apologies in advance if I don't touch on the stuff that you were hoping I might. But I thought it would be good to start with some of the stuff that we've been doing with our wider community and partners around the frail elderly and people with long-term conditions. So the work we said we would do last year around trying to keep people out of hospital and trying to do things differently, and how some of that has progressed. So I doubt if any of you were at last week's National NHS Expo and Conference. But I wasn't. I was on leave for a couple of days, but I got some interesting messages whilst I was away to say, your CCG's been mentioned. There's somebody from your organisation on the stand. So we're part of a national process which is called the Vanguard process, which is a programme of working with, in our case, care homes, so working with the care home world to try and give better care to older people, to try and improve the care they get in care homes, to try and help with training and staff confidence, to cut, hopefully as a result of this, cut some of the unnecessary hospital admissions, but also to provide services in a much more of a joined up way. And you may have seen a couple of people in this room and a number of our GPs talk about this at other events. But what we've been doing with both the County Council and the local Care Homes Providers Association is working with a number of homes, their patients and those patients' families, to look at what makes a difference. So what can we do to improve care? So, so far, 37% of the homes in our patch have received some additional training. And that's been training on areas such as dementia, nutrition, falls, what to do around engaging your local residents. So how can you keep people active in both mind and body? What's the best you can do for people? And as a result of that, we've got 139 at the last count, and it's always going up. Trained champions, who are people that work within individual care homes to try and improve outcomes, to look at what they can do to make people's life experience better. The programme's also been linked to some work we've been doing with primary care around linking GP practices in more closely to care homes and running regular GP, the equivalent of ward rounds in care homes. And as Pauline may touch on later, and I think we pick up in one of this afternoon's later sessions, we've been putting pharmacists into care homes to review medication that people are on and to look at if there are any benefits of doing some of that medication in a slightly different way. And I'm always taken by the facts, and I have to read the figures, that we've seen 665 care home residents, and in doing so have reviewed over 6,300 prescribed medications. So of those 665 people, they're taking over nearly 6,500 different medications. It always strikes me as a completely staggering figure. But as a result of that, in a number of cases, they've stopped over 748 unnecessary medications. So they've looked at the medications people are taking and looked at how they react together and looked at if there are things that can happen differently by changing medications to either improve quality of life or get slightly better outcomes. And I'm sure Pauline will pick up on that later, but it's all about what can we do to try and improve quality of life. So when we look beyond the care homes, so what are we doing with our frail elderly to think about how we provide better care at home? So I think most of us would like to spend as much time as possible with our families and in a home environment. And when we become older, many people used to think the only option was to go to a care home. And I think one of the things we're trying to do is look with the local authority and other agencies around what can we keep doing that helps keep people as well as possible, so that those that want to and can stay at home do. So the Rapid Response Service is a 7-day service. About 96% of the patients it sees are seen within an hour. And since April of this year, it's seen 710 people in their own home. So it allows GPs or other people that are concerned to make referrals to people, to make a referral to the service to come and visit the person in their own home, to see what can be done to improve their care, what we might be able to do to enhance some of the services that are going in currently. So what can we do quickly that prevents that person being taken otherwise by ambulance to the local hospital for an admission, which may sometimes result in their existing care package breaking down, but can also result in them becoming less confident in themselves. So it's what can we do to kind of get care more quickly in people's homes. So what are the alternatives to an ambulance? It works. So on a similar theme, we talked about last year having an early intervention vehicle, and we've had one on the road since the end of April. This is also about people who might be referred to hospital who can have care at home, particularly those that may have fallen ill suddenly, had an accident. And what it allows is a vehicle to be called and to attend a home, currently during a limited number of hours of the day, so 7:30 in the morning till 6:30 in the evening. And we are hoping to have a second vehicle shortly, I should have added. But it's a dedicated vehicle staffed by paramedics or emergency care practitioners and somebody from a health and social care professional. And they can respond to selected 999 calls, often for people that are over 65, but then can treat them in their own homes and then have access to the early intervention services we talked about earlier, often to support those people to stay there. So at the moment, they often deal with people and ambulance calls out related to dehydration, issues related to dementia, urinary tract infections, and some falls. So some falls where there are other associated injuries, but it doesn't look like a break. So what can we do to get care to people in their home, enhance the care they're getting, but try to prevent them going to hospital? So there are some of the things that we've started to pick up by enhancing community services, and we recognise there is more to do. And one of the things we're keen to do in the next 12 months is to keep working at a locality level with GPs and other partners across those areas to look at what else can be done, how can we tailor some of those services to meet people's local need. I'm now going to move on to a service that we spent quite a lot of time talking about last time, which was our stroke service. So this is the new national Improving Stroke Services diagram, which you might begin to see quite a lot in the press. It's going to be part of an ongoing media campaign. So if you're one of the unlucky people who within Hertfordshire, within our area, of which there were 597 last year, who had a stroke, this is the ideal treatment scenario. So this is what your pathway of care should look like. So you should get your care in a specialist centre, have access to all the assessments and treatments you need, received a joined up approach to your rehabilitation, and then be reviewed. And I think if you recall when we stood here last year, we were doing work with both East and North Arts Trust and PAH in Harlow, which is where most of our stroke patients had historically been cared for, to look at how could we improve services and how could we invest some money in making those services better and more responsive and to get better outcomes. During the course of the year, you may well have seen in the local press and in the media that the PAH stroke service did temporarily close, and there's ongoing conversations with the public in Harlow around what the future of those services are. But I thought it would be worthwhile to touch on what we've done. So what have we done to make this different? So in terms of the local area, the pathway for us is when a patient contacts the ambulance service, so when a family member contacts and says there's a stroke, we have a system in place now where the ambulance trust rings ahead to the hospital for suspected strokes. The Lister Hospital now has a stroke specialist nurse available 24 hours a day across 7 days of a week. And this has enabled them to build better relationships with the ambulance trust and others around the identification of patients and to ensure that they get onto the stroke unit as quickly as possible. We've linked to this, issued quite a lot of detailed guidance out through primary care, led by Dr. Sinclair, who's in the room somewhere this afternoon, raising her hand now, on what primary care should look for and how that links into the pathway. When people receive their stroke and they have their care on the stroke unit, we've invested a lot of money in the staffing of the stroke unit. What does that look like? How do we ensure that people get access to the adequate therapists? It's one of the issues that Alan touched on. Trying to get staffing for some of these specialist areas where there are a limited number of skills services in great demand is very difficult. We've done quite a lot of work to make ourselves an attractive place to work, to encourage people to come and work in the service, and we invested money in that stroke service to try and get care right at the beginning of the pathway. One of the challenges we got given by patient groups was, that's all very well and good, it's good to get the first bit of the care right, but what are you going to do around the community care when people come at home, and how are you going to do rehabilitation? We have worked with HCT, so Hertfordshire Community Trust, and the Stroke Association to put in place enhanced rehabilitation for people at home. So we have an early supported discharge stroke service that allows people to come out of hospital relatively quickly and go home and receive their stroke rehabilitation in their own home. But we've also invested in services at both Danesbury and the Hearts and Essex Hospital in Bishop Stortford for those people that need to have their rehabilitation in a bed-based service so that they can receive that there within our patch. I've got some quotes around what people have said, so some of the feedback we've begun to receive about the service. The service is by no means perfect. It is in a much better shape than it was, but we are clear that there is always more work to do. There is more work we need to do, particularly around getting good quality therapists and consistent therapy input, because they're in great demand and they're very hard to get. So if any of you are a trained therapist with an interest in stroke, do let us know, because there's plenty of opportunity. So what happens next? We've got a lot to do around the kind of public health and public awareness bit. So it's all very well and good having a service in place that treats the symptoms of a disease and helps people to get better. But what is it we can do to try and prevent the number of strokes we have? How do we get better public awareness, better detection? Some of the stuff we're doing around with public health, around trying to reduce smoking and trying to help people make healthy lifestyle changes, all link into our wish to try and do some of the stuff around preventing disease. We're also aware that we need to do more around the 6-month reviews. There's a lot we can learn about people's experience of how they've gone through the stroke pathway and what does and doesn't work for them. So we're keen to improve our uptake of the 6-month reviews and some of the self-management opportunities that might come out of that. So some of the things that people say have really worked for them. So if they've worked for them, how do we get some of that embedded in our ongoing practice? And we recognise that that's one of our next challenges. And we also have to make sure that we're meeting the needs of the families and carers of people that have had a stroke in the right way. So are we offering the right support to them? Is some of the stuff that we have available on advice and support groups, are they in the right place? Do they happen at the right time? Actually, do we tell people they exist at the time they need to know? So that was some feedback on stroke. I'm going to move on, if I can, to a number of the other areas we picked up from last year. So transforming care for adults with learning disabilities. We are still part of a national process to try and improve care for people with a learning disability and make this more community focused. We've been working with patient groups and with carers groups to look at some community-based prevention services. So we've been looking at how we support families in crisis in a different way and how we learn from that to prevent further crises from happening. We're also working on continuing to discharge people from long-stay hospitals and allow them to live within the community. And as you'll know, through the All A's Autism Boards and a number of other groups we have in place, we are trying to look at what we can do to make these services better and more community focused. We work with HPFT and Hearts Valleys to try and look at some of these things in terms of what do we do for the wider community. And we're starting to engage with West Essex, particularly around the Bishop Stortford and the east of our patch, to look at what we can do in terms of community groups and support, particularly for families, across the two CCGs. In terms of mental health, it's really difficult to think what is it we could pick up and talk about today. I wanted to pick up a couple of bits that we were very proud of. So one is Cooth. I don't know if any of you saw the stuff that came out about Cooth or have used the service. It's a specialist online counselling service for young people, which is free for them to use and is available daily, 365 days a year. We got 700 users sign up in a 3-month period. And particularly around the exam time, and going into the exam time for this year, we were seeing significant numbers of young people log on, seeking advice, actually sometimes just to have somebody for a bit of support that wasn't their family to talk to about how stressful life was. It's something that we hadn't tried before, but it's about how we're trying to embrace new technology and different ways of working to try and engage people in what works for them to manage their own health. So linked to that, last time we talked around mental health training and suicide awareness, and we've been running with HPFT a number of schemes, a number of courses on mental health first aid and suicide awareness, not just for NHS staff, but for a number of other organisations. So we're running some courses in John Lewis's in the next couple of weeks around how do people think about mental health and how do we recognise mental health symptoms in others. As part of this, we're one of a small number of places in the country that are rolling out the Mental Health Youth First Aid Training Scheme, which is going down very well. We're getting some very good support and engagement from schools and public health and others around how we get people to recognise issues around anxiety, begin to talk about them and reduce some of the stigma. So I wanted to mention that. I'm conscious of time because they'll tell me I'm overrunning. As you will all have seen, the QE2 hospital in Welwyn Garden City opened just over a year ago, and I cannot believe that it is almost 12 months since we had the official opening.